I greet you all, welcome you all on behalf of SCPGMS from Lucknow. The topic assigned to me was or is how digital India is impacting healthcare. I hope I am audible to all of you very clearly. This very platform, this very program, this very concept, the execution and delivery and monitoring and later on review is a proof in itself as to how digital India is impacting healthcare. What do we mean by the word digital India? Digital India, from the frame of reference of medical sciences, looks at the intersection of medicine and technology. I would like to give you, I believe all of you are in medical schools doing your MBBS. So I would like to sensitize you, or will try to make you understand the changing canvas of the healthcare delivery and how technology is gradually taking over rather. There was a time when there was clinical medicine, and now it is, a time will come when we will talk of digital medicine. Today we are somewhere in between these two. Clinical medicine is a thing of past. Now the digital medicine is something which is about to come. Today we are somewhere at the juncture, the phase of transition at the crossroad. So here is how I propose to go. I'll give you a brief introduction and will give you an overview of the digital India. Then we will discuss a brief about the role of digital health, the driving forces in India, what all drives it, couple of parameters to take care of, and the goals and objectives that we are aiming at, and how there is a gradual ushering in of digital transformation in healthcare delivery in our country. Ongoing initiatives under the Ministry of Health and Family Welfare, and we'll try to peep into future as well, apart from the challenges that may crop up before I conclude. Dr. Tedros, WHO DG, once said, harnessing the power of digital technologies is essential for achieving universal health coverage. Ultimately, digital technologies are not ends in themselves. They are rather tools to promote health, keep the world safe, and serve the vulnerables. We all have witnessed in the preceding 2.5 years how they gradually and drastically there were changes in the way the world started communicating as a consequence of the COVID pandemic. Digital India in our country is a campaign launched by the Government of India in order to ensure that the government services are made available to citizens electronically by improved online infrastructure and by increasing internet connectivity or making the country digitally empowered in the field of technology. This is something which is a generic policy or a vision of the digital India. We have to look at it from the healthcare delivery perspective, from the patient-doctor perspective, from the healthcare organization, healthcare seekers perspective, and how it happens, how it's happening, how it did happen, and how it will happen in years to come. We'll gradually have a look at it. The new health technologies such as wearable technology, telemedicine, genomics, virtual reality, robotics and artificial intelligence are changing the landscape of the healthcare system in general in India, and in particular in Western world. We are trying to catch up with them. Like many other markets, India too is at the cusp of a digital health revolution. Digital health technology is a pivotal pillar in delivering value-based care across the healthcare continuum in India. Adaptive intelligent solutions can help lower the barriers between hospitals and patients, improving access to care and enhancing overall patient satisfaction, particularly in Tier 2 and Tier 3 cities in India. is something which should be coming up subsequently later on. Right now, tier 1 cities, the national or state capitals or metros are taking the lead. The driving forces are why do we need all this? Apart from the COVID-induced compulsion, which at one point in time brought the entire world to a standstill, we still need it because of many things. That lifestyle diseases, aging population, so it is the pyramid is reversing, rising income levels, increasing access to insurance, like the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Recently, government of UP is about to launch the Deen Dayal Upadhyay Jan Arogya scheme, and there are many such schemes under operation. So now there are someone else to pay for your health care. That has led to more demand, and otherwise people used to ignore for want of money. And obviously, growing health awareness, people have become health conscious. Recently, the data released by Government of India, Ministry of Health and Family Welfare, in a based on the sample survey (SSS), we have again the life expectancy at birth has increased by a good number of years. The primary objectives or goals of digital health, which gradually in days to come will change the landscape, change the modality, change the way the healthcare will be delivered in months or years to come, even in our country, be it in city or be it in a remote village. Even now, NHM has introduced the concept of telemedicine up to the level of CSCs, the community health centers. Not all, but good number of community centers have got referral services that's being offered through a third-party telemedicine platform. That's not a government platform, but at least NHM has joined hands with those providers, and the patients at the level of referral centers are able to obtain super specialty consultations by super specialists without having made a visit to that place at the convenience of their own CSC. It's being rendered through the telemedicine network of a private body. This digitization or the amalgamation of digital technologies with medicine per se is transforming the healthcare delivery, wherein telemedicines, to name a few, telemedicine itself that we are using right now. Right now I'm communicating with you through telemedicine network, electronic health records for that matter. And it will eventually lead to, government has already launched that National Health Digital Mission, NHDM. NHDM is in its phase of infancy, and when you people pass out and take over the cudgels from your seniors of delivering healthcare all across the country, you will see that by that time, NDHM, National Digital Health Mission, would have been in place in a substantive way, and you will see that the patient's healthcare database is available in a chip, and there is a reconciliation of the information, notwithstanding where the patient is, in which state the patient is, in which institution the patient is, wherever you go, the data goes. So there is a seamless transfer or carrying over of the information with that smart card or chip or assigned unique number. So what is happening today? If you come to PGI or to your hospital, as a patient comes, a case file is opened in hard copy and is placed over that in the medical record section once the patient is discharged. And when he visits some other state, some other city, some other hospital, some other country, the data is not available. And whatever patient can recall or can bring unto himself the photocopies or whatever. But once we are firmly into the NDHM, the National Digital Health Mission, it aims at digitizing the patient data and its seamless movement across healthcare facilities. Wherever the patient goes, the data travels. So it will lead to tremendous medical reconciliation while delivering healthcare. Likewise, robotics, self-monitoring devices like Holter monitoring of the blood pressure, Internet of medical things. You will see the technology converging to the internet interface of the internet. the medical knowledge, expertise, and technology on the other end, they are converging together on this interface. And right now we are using it through telemedicine, and I am delivering a talk, and all of you are listening from far and wide locations. Then is mobile health. I mean, mobile health is a very good classical example of convergence of technology. I mean, I had been to a conference recently wherein I saw that how mobile is replacing a pathologist. I mean, to a histopathologist. When the slide is prepared, photograph is taken, high resolution photograph is taken, and the artificial intelligence reads those slides and gives you decision about the probable diagnosis. It doesn't obviate the need for human expert, they will still be required, but it's making the task easier. It's bringing a sort of standardization and a sort of homogeneity across the opinions. In organs are not chip based. We put in, I mean, chip implantation is not new now. Even in our country, it is being done maybe at a research level. But the chip based information acquisition is at least there, if not treatment for now in our country. Telemedicine facility exploded particularly soon after the lockdown imposed by the pandemic came into effect and continues to be a game changer for various health institutions. Not only has the ability to remotely consult specialists been beneficial to existing customers, but has also enabled new customers to connect with specialists of their choice irrespective of location. That's important. Consultant of choice, independent of location. Location, independent consultation. Hence, facilities which used to have only a local clientele are now able to reach out to a much wider audience. Delivery of healthcare services where distance is a critical factor by all healthcare professionals using ICT for the exchange of vital information for diagnosis, treatment, prevention of disease and injuries, research and evaluation, and contribution are of paramount importance so far as harnessing upon the telemedicine is concerned. We ourselves at SGPGIMS harped a lot on the telemedicine during the COVID pandemic, wherein the tele-ICU was being run and tele-consultation was being provided. EUPDs were there in place. They're still continuing, in fact. And the PGI is going to come up with a huge tele-ICU project for the entire state of UP, based on a hub and spoke model. So that's you the younger students who have stepped into doing, pursuing a career into medicine or doing your MBBS from different institutions in the country. You will see that in next 10 years, in a decade, the entire trend of delivering healthcare would change substantively, wherein technology will become predominant rather than the clinical, core clinical or pure clinical or absolute clinical things. It would, both these two things become, will be converged together. The subdomains of telemedicine, so far as medical care is concerned or health care is concerned, are teleradiology. It's happening in good way in India even in tier 2, even tier 3 cities I have seen, wherein there are small nursing homes, they have installed CT scan machines, they are doing CT, but they don't have radiologists with them. So it is the transferred over the digital network, and remote location radiologist gives his or her opinion. Tele-nursing, delivery management and coordination of care and services. Tele-ICU, I have just shared with you how we experimented successfully with the tele-ICU concept during the COVID. Teleconsultation has been now firmly established to some extent in the country and to much extent in the southern part of the country, the peninsular India, and now even in UP, government has taken it forward at the level of community health centers, wherein select community health centers have been provided telemedicine network, and thereby providing specialist opinion to the patients, notwithstanding location they are in. Telesurgery, we all are witness to the fact that I think somewhere back in 1999 or 2000 something, when the first telesurgery was conducted, where the surgeon was in Britain and the patient was in France. It was done through telerobotics. The surgeon was in the console in a different country, and patient and operating robotic arm was a different country. So that too is possible, and it's now expanding in a big way. how it benefits us. The advantages are it saves upon cost and effort, especially for rural patient or I would say remote location patients, provides saves time, is faster access, maintenance of record documentation is very easy, and there is seamless transition and reconciliation. Patient safety as a health worker safety also increases because of reduced direct interactions. Telemedicine can also enable the availability of vital parameters of the patient available to the physician with the help of medical devices such as blood pressure, blood glucose, etc. for management. Many common highly required parameters are now left to gadgets. They, say for example, there are gadgets available which monitor your carbohydrate intake, which monitor your blood glucose level. Then they give you example of the insulin required, and they give commands to the subcutaneous pump, and that insulin injected in your body. So it's all automated. So technology has come to that extent even today. So you can very well imagine in days to come how it's going to be. Electronic health records, Government of India promulgated its first guideline in 2016, wherein they have made it. I mean, they have not made it mandatory for now, but they have released an advisory to the healthcare institutions to gradually shift to electronic health records, and gradually it will lead to it will obviate the need of keeping hard copies or of the records. The Government of India has introduced a bunch of new regulations, standards, such as amendments to the Clinical Establishment Act for ensuring data compliance, National Digital Health Blueprint, and Personal Data Protection Bill. These initiatives have ensured that digital copies of a patient's medical history, investigation findings, medication, diagnosis, and treatment are now easily accessible through authorized medical or mobile applications or other digital interface. Not only mobile, it could be other digital interface as well. A few examples of the private players who have ventured into it. The advantages of EMR, they are accurate, up to date, and complete. Quick access retrieval is easy, and it reduces errors. It is more reliable. It adds to patient safety. Privacy and security of data is little debatable. Government is coming up with a legislation, because right now the data is being stored on cloud or some local servers, and there could always be a possibility of breach somehow or the other. But then as the things will evolve, it will be taken care of, and obviously it reduces the cost in every way, be it creating, be it maintaining, be it retrieval. At all level, the cost is reduced phenomenally. I discussed with you robot-assisted surgery. Using the assistance of robots, the surgeons are performing surgeries with better efficiency, reduced blood loss, better pain management, and quicker recovery. Micro robots for diagnosis and treatment of disease, like capsule endoscopy, in which the patient swallows a tiny camera so that the healthcare provider can take pictures of the digestive tract. Future focus is removing plaque from the arteries, taking tissue biopsies, attacking cancerous tumor cells directly, and delivering target medications. So all these are on the anvil, and will soon have them in practice when you people enter into the practice, say for example 5, 7, 10 years from now. Much of them would have been trickled into the system. Remote monitoring of patients. Tools that enable medical facilities and professionals to remotely supervise their patients, have their readings sent to them from time to time, and facilitate two-way communication. I'll give you an example. Government of India has launched Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. There is one arm of this scheme that provides for remote monitoring of patients through telemedicine network, wherein, say for example, in UP, 3 hubs have been identified, and in each hub there are identified health centers or CSCs or referral centers, and they are connected through telemedicine network with identified telemedicine centers, and their experts are available in a slot wise, and the patients who are coming to those primary point of care giving, they put up their issue. If the available doctor is not able to take care of that, then they use that telemedicine network and they consult with them, and there's two-way communication, because as the instance of the expert available at other end, the doctor on this first end does investigation and sends reports and obtains prescription. So there's a two-way communication firmly in place, doing well. Even at our institute, we're also a hub of the Ayushman Bharat telemedicine network in our state, for our state. There are self-monitoring healthcare devices or wearable medical devices that are in the offing. It is defined as a device that is autonomous, non-invasive, and performs a specific medical function such as monitoring or support over a prolonged period of time. Even during I was doing my MBBS, at that point of time, there was a device that we used to place for the continuous monitoring of the blood pressure. Now it has advanced too much. We can do a lot with the wearable devices. It is a combination of object and biosensors. It can measure blood glucose, blood pressure, pulse, and other biometric data which requires to be monitored constantly or continuously. Real-time information is then sent to the healthcare providers, and there can be two-way communication. Based on that, the feedbacks come back for actions to be taken upon where the patient is. Biosensing, another example, biosensing smart contact lenses. Wireless smart contact lenses could be the answer to detecting diabetes and helping to treat diabetic retinopathy just by wearing them. Because at three locations, the nerves, the kidney, and the retina, the entry of glucose is independent of glucose. Otherwise, for the rest of the tissue of the body, the glucose entry is insulin dependent. So insulin independent glucose entry, I mean there is high blood glucose level and the osmolarity of the blood is high, then it becomes, when its solute is more in the solution, then its solutes diffuse and goes to these target organs and damage them. But having such sort of devices with technology interface, we can sense them early and take preventive measures. Which I told you in the beginning. The Internet of Medical Things, IOMT, it is nothing but convergence of digital technologies, medical science, and the interface of the Internet. So there is one digital interface. At one side there are many technologies, at the other side is healthcare delivery system, and this interface connects these two meaningfully, scientifically, and bilaterally. Mobile health is another domain. It refers to the practice of medicine and public health supported by mobile devices such as mobile phones, tablets, personal digital assistants, and the wireless infrastructure. And there are many applications in use right now, app-based. Mobile phones are enabling self-diagnostics, enabling patients to identify and manage health. Netraj is a device which attaches to a smartphone and enables patients to perform their own eye test by measuring the refractive error of the eye. And likewise, heart monitoring, the extra-auditory meatal view, or the glucose monitoring. So we have got applications for this, and likewise for many such things. It is tremendous. If you look at the medical mobile apps, which help in diagnosis or at least monitoring, if not diagnosis, and you will find them aplenty. They are diet and nutrition apps, fitness apps, patient and provider care app, medical device accessory app, wellness apps, patient and provider care app, and medical device accessory apps. Organs on chips. It is like simulation sort of thing wherein the cell space placed on chip with a physiological fluid, they behave in a real way. So instead of doing experiments on human or animal cells or animals, you can do it here and look at the real changes, how different variables or change in the variable interact with each other and modulate and give a different outcome. You can see all it beforehand before you actually do it with even animals. So it is more ethical and it is pro animals to say. Government of India has taken many initiatives to ensure that we make the right move forward in times. They are using the digital technology in big way in RCH, IDSP, EWIN, NHP, national identification numbers are being used under NDMA, National Digital Health Mission. ORS is there since long and is available for free. All of anyone can, any government institute can use it. It's Aadhaar Senior Registration System. Mera Aspatal is a patient feedback system and National Medical College network that we are right now interacting through. The future of digital health in India. I mean, what I think that robotics, artificial intelligence, and the application of these two in the frontiers of medical care will bring in transformational change in healthcare delivery in times to come, apart from smart health monitors, which and the different technology which will subsequently be used for DNA analysis for certain genomic testing and treatment options. Mobile health apps we have discussed, and virtual reality will also help us control or manage the stress or pain or other psychosomatoform disorders or things which have got a bearing, I mean the affective disorders to say, if not cognitive. What is the advantage of digital health? The quicker access to test results, easy to pay, sharing of information is very easy for the care providers or caregivers both. And it offers clinicians notes, feedback, patients can review information for medical errors. I mean, researchers, investigators can do research upon very easily with the data which is fired in. Instructions, information is simple and easy to document, and patient has a better approach and access to the medical records, and it's a very good tool for health protection. But everything has got a flip side too as well. Complicated and complex health information causes concerns for the patients. Right now we are living in an info age where we use the word information explosion. There's tremendous information available. It becomes a tough task to figure out, to squeeze out, to cull the appropriate data or information is required for an appropriate decision making. Cases reports elevate patients providers with concern. Hackers can approach that is a big concern, and it is still unaddressed. And different countries and in our country, people are working on it from technology perspective and to provide legal safeguard as well. So it is being looked at from both the two perspectives. It needs to be upgraded on a regular basis because technology is developing so fast that today we are using one version, becomes obsolete after some time. And digital health records are expensive, but I don't think it is so expensive, and it will soon be user friendly and cost efficient as well. Although it will remain complex and complex for sure. So to conclude, digital healthcare in India, like most other countries, has received a much needed shot in the arm and is maturing by the day. Organizations within the industry as well as enterprises enabling the industry to transition are thinking of novel ideas to further improve patient care, coordination between employees and facilities, and create smarter medical devices that make diagnosis faster and more accurate. The continued transformation will ensure that more patients that's the aim, because country like India, the technology or expert cannot reach everywhere, but by using technology, the expertise can be provided everywhere. That's why it is more important for a resource-constrained country like us. Attentions as those in big cities, and a stronger workforce will build thanks to remote learning. Overall, we can be optimistic about the future of one of the largest industries of the nation and look forward to new and exciting developments in this year and years to come. Thank you all. Thank you very much. If you have any question, then you are welcome.